Hello, my name is Daniela Collaso, and today I'm going to be presenting my health promotion topic, osteoporosis. Osteoporosis is a disease characterized by diminished bone mass, decline of the bone matrix, and reduced strength of the bone. It affects an estimated 25 million people in the U.S., and it develops due to an imbalance between bone resorption and formation, where bone resorption exceeds bone formation. This causes the bones to become porous, weaker, and thinner, which makes them susceptible for fractures. Non-modifiable risk factors for osteoporosis includes being a woman, being of Caucasian or Asian ethnicity, having a small body frame, age over 65, history or family history of fractures or osteoporosis, being postmenopausal due to the decrease in estrogen, which has protective effects over the bone, or having underlying disorders that affect calcium balance, such as hyperthyroidism. Other risk factors associated with developing osteoporosis includes premature birth, endocrine and malabsorption disorders, smoking, sedentary lifestyle, alcoholism, and certain medications such as corticosteroids and proton pump inhibitors. Some signs and symptoms of osteoporosis includes a decrease in height, stooped posture, back pain, and increase in fractures. Osteoporosis is sometimes referred to as a silent disease because patients might not even be aware that they have this disease until they fracture a bone. A DEXA scan is a type of medical imaging test that uses low levels of X-rays to measure how dense your bones are. It is the gold standard for diagnosing osteoporosis and assessing bone mineral density. The USPSTF recommends that women age 65 and older get a DEXA scan, and women younger than 65 get a DEXA scan if they are at an increased risk for osteoporosis. In men, the USPSTF states that there is no current evidence that supports the screening of men for osteoporosis. However, the National Osteoporosis Foundation recommends screening men at the age of 70. The results of the test can range from a positive 1 to a negative 4. If the results are positive 1, 0, or negative 1, that indicates a normal bone density range. Negative 1 and negative 2.5 indicate osteopenia range, which is below average, and negative 2.5 to negative 4 indicate that the patient has osteoporosis. One way we can help prevent the development of osteoporosis is by consuming a diet rich in calcium and vitamin D. We need vitamin D in our bodies, in the intestines, in order to absorb calcium. So examples of vitamin D-rich foods include fish, peas, cheese, and eggs, and calcium-rich foods include tofu, green leafy vegetables, beans, lentils, sardines, and of course dairy like cheese and milk. And if someone is having a hard time consuming these foods or they just don't like them, there is a supplement as shown in the slide. It doesn't have to be this one, but this is an example of an oral supplement that they can take that does have calcium and vitamin D. Other ways to help prevent the development of osteoporosis includes partaking in weight-bearing exercises for 30 minutes at least 3 times per week. Weight-bearing exercises include walking, running, water aerobics, and weightlifting. Another way to help prevent osteoporosis is by obtaining 10 to 30 minutes of midday sun every day in order to contribute to adequate vitamin D levels. Meds used to treat osteoporosis include anti-resorptive therapy meds such as alendronate, which is first line, Prolia. There's also the selective estrogen receptor modulators such as raloxifene. There's also estrogen and progestin therapy. And then there's anabolic agents such as Forteo, and this is for severe osteoporosis. Thank you for watching my presentation. I hope you learned more about osteoporosis, the risk factors, signs and symptoms, screening tools, what we can do to prevent osteoporosis, and common meds prescribed for osteoporosis.